Thanks, everybody. It is no secret that our province is facing significant fiscal pressures. That was true before COVID, and we've endeavored to respond in the right ways over the last 4 years. Our anniversary of our election is later this week, and happy anniversary to anybody who wants to join in that celebration with me right now. But I do want to say that with the COVID crisis and the pandemic that we're facing, the fiscal pressures are additional and very real. Shutdowns of necessity of large parts of our economy, as well as large expenses that we nor any other jurisdiction could possibly have estimated, are now required to be made. And so this recall of the legislature today was an effort, cooperative, I believe, to keep Manitobans safe. We have made some progress so far today, and I anticipate more to be made in the next few hours as we move forward on a variety of pieces of legislation. I'll just go over, if I may, a quick overview of some of the items. We've increased our spending power, so now we have funds at hand to quickly help those in need, whether it's delivering on the promise and the need for more personal protective equipment, other resources to frontline workers, whether it's supporting families who need access to health care and other supports, whether it's aiding businesses through tax deferral and other measures, some of which I'll outline next week. We are enhancing the spending power of the government to address each of these issues. As I had mentioned previously, we did set aside a rainy day account, a fiscal stabilization account, and we are using the funds available there, but we do not expect that those funds will last for the duration of the challenges that we have to face, and so this is part of the reason for the initiatives today. Specifically increasing our spending authority by approximately $1 billion on COVID-19 pandemic-related investments to be allocated to categories like the Health Services Insurance Fund, where we'll be putting in $500 million, $400 million for the Internal Service Adjustments Appropriations of Government, and $100 million for additional emergency expenditures. Now, I should mention that approximately half of this $1 billion of additional investment will be directly available for healthcare costs, and the other half available for allocation to new pandemic-related costs across the whole of government. So this will allow the flexibility for us to create new government programs to respond to various challenges in various categories. Also to expand support services as they are needed, some of which we've already done, and I'll give you a bit of a report on that tomorrow. But also increasing costs under programs previously announced. For example, things like rent assist to support those who struggle to find accommodation that is affordable and to meet their expenditures on that category. We've already close to tripled that program. We expect that we'll need to put more money into that. Also for unfortunately, our welfare programs and other programs to support those in need. So these are just an overview of some of the programs that will receive funding today. In addition, the province is going to be doubling the emergency expenditures budget with a second commitment of $100 million. As you know, in our provincial budget, which seems like a year ago, but was just a few weeks ago, we allocated an additional $100 million to go to emergency expenditures. That was a record at the time. Now we're doubling that to $200 million. This is very important. We have to remember in Manitoba that we don't just have pandemics. Apparently, we also have fires and occasionally floods. We hope not to have them, but we are prepared to have them and to be responsible in covering costs as a consequence of them. The existing funding for emergency expenditures was needed for the COVID-19 expenditures to date, and so we needed to set aside additional funds in case of other possibilities or eventualities. I want to also let Manitobans know that their government is thinking about economic recovery too. One lesson that's become, I think, increasingly evident in our province as a result of this pandemic is that the stronger our economy is, the stronger our social services can be as well. The two things aren't separate. They're interrelated. And so right now our economy is suffering. But we want to continue to work with our small business community to build towards economic recovery. We have a record, and you saw this just yesterday with the projections that came out from the federal government on each province and the federal government and their economic impacts of the pandemic as projected in 2020. What you saw from those numbers is that the province that was projected to have, and all provinces will have, and the federal government will have, a negative consequence of the pandemic. That's no secret. But Manitoba was projected to have the lowest negative impact in terms of its loss of gross domestic product of any of the Canadian jurisdictions and the federal government as a whole. Now, that doesn't get us out of the woods. It just means that we're not going to suffer as much as perhaps some other provinces. In the meantime, however, to make sure that we're ready, we have been consulting with business groups in a variety of key categories in our Manitoba economy, and we have established working groups that will continue to engage with these various sectors that have been negatively, especially we're focused, of course, on those sectors that have been negatively impacted by COVID-19 to date and that may continue to be negatively impacted. Some of these industries include, but are not limited to, the greenhouse industry, if I can call it that, and you know what I mean by garden centers and greenhouses, parks, sports organizations and facilities such as, for example, golf courses, the restaurant industry, salons, the non-essential health care industry. We talk about physio, the chiropractic industry, and so on. These are important industries, and what we're working to do effectively with these industry leaders, healthcare professionals, and government officials, is to develop a made-in-Manitoba path to recovery for each of these sectors. Protocols have to be developed also for recovery that ensure that the health recommendations of Dr. Roussin, our Chief Provincial Public Health Officer, who is doing a heck of a job and deserves a real pat on the back, I think, from Manitobans for the work he's been doing. His participation in developing these protocols will be very important because the safety of Manitobans will continue to be our #1 priority. As Dr. Roussin has said repeatedly, and I will repeat as well, now is a critical time, and we must adhere to the strict social distancing, hand washing, and other protocols, and as much as is possible, stay at home. Following these measures will help to keep the curve flat, and to keep that curve flat is critical, but we also need to get ready for the recovery that we know Manitobans are capable of and that we all want to see happen. With that, of course, there are many other initiatives that are under discussion today, but I'll leave it at that and take any questions you might have.
Thank you, Mr. Premier. A reminder to our reporters online, you will have one primary question and one follow-up question. From the Winnipeg Free Press, Carol.
Hi, Mr. Premier. It's Carol Sanders at the Free Press. Can you hear me okay?
Better than yesterday.
Okay, good. So why not provide some direct financial aid right now to renters and small businesses?
Well, as I said, we've just got clarity from some additional clarity from the federal government on what their support programs would be for small businesses as late as last Thursday, with more questions remaining to be answered this week. In making sure that we have a program that helps people who are potentially falling through the cracks, we have to understand what those cracks are first. And so we've been endeavoring to work in partnership with the federal government, not compete with them. This isn't about who gets credit. It's about who we can help most effectively. And so we want to develop our programs to complement and support what the federal government's doing, not duplicate what they're doing. For that reason, we'll have more to say on this as we've gotten greater clarity over the last few hours from the federal government on some of these issues. We'll have more to say on programs we've had in development for some time to support not only our small business sector, but other individuals in our province who may be needing the support that's not there from the federal programs that we now understand, we now have more detail on.
And my follow-up question is, both the Prime Minister and the Leader of the Opposition have been criticized for their travels during the Easter weekend to be with family, and it sort of appeared to conflict or contradict the messaging about the public staying home and the need to follow social distancing measures. Mr. Premier, can you tell us what your Easter weekend travels entailed?
Sure, I could, but I'll start by defending the Prime Minister and Mr. Scheer. I'll start by saying they each have tremendously difficult jobs. They're doing the very best they can, and I understand it's easy to criticize any of us, but I won't jump on that bandwagon. I'll simply say that the fact of the matter is there's amazing responsibilities being borne up by a number of people in our country right now, and I think the time for second-guessing and criticizing is probably not here yet, so I'll just leave it at that. As far as my Easter weekend, it was spent with my wife. I didn't have the opportunity to spend time with other members of my family, and I think probably like most Manitobans, I missed that. That being said, I'm trying to do my best to maintain Dr. Roussen's instructions and to repeat them as much as I possibly can.
From Global, Brittany.
Good afternoon, Mr. Premier. Brittany from Global News. Just a few weeks ago, there was a bit of clashing between your side and the NDP as we were trying to get the budget tabled through. Now, we're hearing a little bit just earlier this afternoon on Bill 54 that Mr. Friesen was talking about, saying it's designed to accompany the Federal Quarantine Act, and saying the NDP wasn't jumping on board with that. How do you think both sides of government are working together today to get a number of bills passed through?
It's 3:32 on a Wednesday afternoon. I expect we'll be sitting we won't see the clock at 6 o'clock. We'll be sitting into the night, and I expect that the level of cooperation that's been demonstrated thus far should continue. I don't want it to deteriorate, and I don't think Manitobans deserve that. So this isn't a time for partisan politics. It's a time to protect Manitobans. It's a time to work together, and I would sincerely encourage no blockades in the legislature again. Once is enough. The sequels are never as good as the first one anyway.
Thank you. My apologies. It was actually Bill 59. As we're talking about some of these bills right now, why is it so important that we get these through today so that we can start getting these measures flowing to Manitobans? Well,
I think, Brittany, you're probably, and I don't have the bill summary right in front of me. Could you verify, you're talking about the ability to administer fines and to oversee, the adherence to social distancing and that type of thing? Is that the bill you're talking about right now?
Yeah, public health was what I was talking about before. I accidentally said Bill 54, which is the Emergency Measures Amendment Act, but just in total, a number of, seven bills looking to pass today that are important to be getting through to help people in Manitoba during this time.
Yeah, no, absolutely. And we don't present bills lightly here. We think them through, and in particular with COVID, we've done our best to come up with a suite of bills and legislation that will strengthen our ability to protect Manitobans. Whether it's the ability to administer fines when people decide that their selfishness should prevail over everybody's best interest. It's sad, as I've said before, to have to do that, but this is the type of thing we need the support of all parties to do. So we're going to be thoughtful in this. I understand the NDP is concerned about the training of these people. That's never covered in legislation. Generally, that's a regulatory issue. But of course, we're all concerned that people be properly trained. We'll make sure that happens, and it has been happening, and it will continue to happen. But we need to be sure that we have the ability to administer proper securities and deterrence to help keep Manitobans safe. It's a reasonable and common sense bill. I would hope the NDP would see the wisdom of supporting it.
From the Brandon Sun, Drew.
Thank you, Mr. Premier. This is Drew May from the Brandon Sun. How did the meetings go yesterday afternoon with union leaders on the proposal to shorten the work week for some civil servants?
Well, I think reasonably well. I think the key thing here is that we have a need to be able to focus our resources. We have to be adaptable. And right now, in much of government services, there isn't a need for those services. So let's move our resources to the front line, do a better job of protecting those people in the front line, frankly, who we're counting on right now in this pandemic situation, and do it in a way that doesn't require people to be laid off. And I think this is a way that we can make sure that people have continued cash flow, that they have their jobs back, that they're able to know that their pensions aren't going to be negatively impacted, that their benefits aren't going to be negatively impacted, but that they can do their part to support the front line. I think it's a reasonable proposal, and it's common sense to me that we want to keep people working, even though it's at somewhat reduced hours, so that we're able to support our front line. And I'd add that there's some confusion out there, apparently. Some people think that this is a way to get money out of the federal government. Not at all. The employment insurance program's funded by us. We're the contributors to the employment insurance program. The federal government administers it, but they don't pay into it. Manitoba's paid $2 billion plus into the employment insurance program through employer and employee contributions over the last 10 years alone. And we're just talking about using a program that was designed for exactly this type of situation, to keep people having some income while they take some time off, so that we can all support our frontline services. It's good common sense, and it sure beats laying people off.
And something that I know some of my colleagues have asked before, but on your proposal a few weeks ago for federal help to borrow money, has that gone anywhere yet? Have you got any messages from the federal government that it might be helping out with that?
Well, we've had favorable comments from a number of think tanks and so on. I'm talking to the Deputy Prime Minister. I believe we're scheduled for tomorrow on this and a number of other issues. And I want to say thank you to Chrystia Freeland for being available to me and to other premiers as we have had issues that we've needed answers on, or we've wanted to give input on things that I think is commendable, and I thank her for that.
From CJOB, Diana.
Good afternoon, Mr. Premier. Diana from 680 CJOB. Kind of following up on Carol's question with regards to rent, are you leaving the door open for help to renters? Is this something that could be coming? Obviously, you have announced the freeze on increases, but is the door still open for further assistance to renters?
We've announced programs not only to give greater security to renters, but also for kids aging out of care, for $1 million+ for homeless people, people with disabilities. We've announced employment and income assistance supports. We've announced rental assistance in terms of ability to defer. We've protected people from evictions. We've announced very, very significant increases in our rent assist budgets previously and anticipated, as well as for welfare payments. Rent assist program has tripled since we came to government. We've got programs to assist in terms of housing and child and family services, seniors. We've developed dozens of other programs. I'm not going to give you a complete list. So, yeah, I mean, these are on the table, and there's no doubt there's going to be lots more ideas coming forward. We're going to be focusing with some programs that are nearing readiness now on some small business protections we think are essential for those who are, shall we say, missed by the federal programs, while at the same time partnering with the federal government to make sure that we can land the plane on the programs they've announced to date and not duplicate them. We want to make sure that we help those programs be made available to Manitoba charities, nonprofits, and small business organizations so that they can help. They can be helped by them. So lots more on the table, but the key point is that we're not wanting to duplicate. We're rather wanting to complement what the federal government is doing. This isn't about who gets the credit. It's about being on Team Canada, and Team Manitoba is alive and working hard on that.
Okay, and then as a follow-up, Dr. Rusin mentioned earlier today that some people who are sick, legitimately in need of health care, aren't going to hospital out of concerns of catching COVID-19, or maybe because they feel guilty about using health care resources if they don't have COVID-19 themselves. So when they do finally show up, they're in pretty bad shape. What is your message to Manitobans who may actually need health care at this time for non-COVID-related reasons?
Well, my hope is that they'll continue to pursue health care as they need it, and that is why we've focused so much on frontline care, why we've readied our system not just for COVID, but so that it's available for people when they need it. And so I'd encourage Manitobans not to delay if they have a health concern. This is why our system's been reorganized, and never easy, change is never easy, but as these changes begin to work, we're going to be able to see better care sooner for Manitobans on not just pandemics, but on other issues as well. So if you're hearing this and you've got a healthcare concern yourself or a family member does, I encourage you to make sure you use the system. That's what it's designed for. It's not designed just for a pandemic. It's designed for the other healthcare needs that you must have addressed, and you should have them addressed immediately if they are of concern to you.
From the Winnipeg Sun, Josh.
Good afternoon, Premier. This is Josh Aldridge with Winnipeg Sun. I have a question about Bill 44. It was brought forward this morning for a second reading and held up by the opposition. Why was it deemed necessary to bring that bill forward today? And why was it brought forward today?
Josh, help me out. I don't have my bill list in front of me, and I don't have all the numbers down. We've got a lot of bills presented today. What's 44?
Sure, that's the Public Utilities Ratepayer Protection Regulatory Reform Act.
Right, yeah. Well, the idea of this bill, it's a very complex bill, but the idea here was to increase the effectiveness of the Public Utilities Board in dealing with issues that are germane to consumers in our province and providing a more appropriate balance so that we're not wasting money and time without fruition to protect Manitobans. You know, the NDP will make the decisions they make on blocking bills. That's their decision. But our job is to keep the business of government going. That's why we came back today. It wasn't just for COVID. It was also to make sure that we can present the necessary bills to move our legislative agenda forward. There was an election. There was a decision made. The decision was that we had the right to move our agenda forward. So that's exactly what we're trying to do today, as we should.
All right. My follow-up is we talked a little bit about Bill 54 and Bill 59, the Public Health Amendment Act, and the Emergency Measures Act, which were held up on second reading this afternoon. Can those be brought back in a later session tonight, or would those have to be dealt with at a future sitting of the legislature? You mentioned it could be in the later hours tonight. What's the prospect of those getting passed either today or at a future date?
Well, I guess I can only answer you this way. I think that it would be really unwise for the opposition to try to block what they tried to block a month ago, much to the chagrin of, I think, Manitobans. We're dealing with a pandemic. We have challenges that have to be faced. Those items you mentioned are legitimate legislative changes we need to empower our ability to stand up and protect Manitobans. So if the NDP decides to block them, I think they're risking the disrespect of the general populace, quite frankly.
From CBC Manitoba, Ian.
Good afternoon. There have been, I guess one of the bills refers to price gouging and penalties for that. Throughout this pandemic, have there been confirmed reports to your office about price gouging, and what has been done about them?
Not to my office. I'm not aware of any, Ian, but I know that we need mechanisms to deal with them should they occur, as they have in other parts of the country, and that's the purpose of the bill.
Okay. And follow up here, the NDP was concerned during negotiations that your party would bundle sort of the existing bills with the new COVID legislation. Ultimately, in practice, that didn't happen this morning. Why did your government decide to separate the bills?
Well, it's the same way we presented the bills when they blocked them the first time. We didn't do an omnibus bill for the very reason that we're a transparent government that wants to give the public a chance to read each bill, and we wanted to give the opposition the chance to agree or disagree on each bill as they so choose. So we decided that it made sense and it was fair to put the pieces of legislation succinctly by category in the various acts that they should be positioned in. In other words, we did what we thought was the right thing, and I can only hope that the opposition recognizes the rightness of the approach that we've taken today, even though they didn't a month ago.
From CTV Winnipeg, Jeff.
Well, Mr. Premier, Jeff from CTE Winnipeg. This is a clarification question. Does 54 and 59, the two bills of note today, will that allow municipalities levy the fines that you announced Friday more widespread, like allowing bylaw officers and others? Is that what one of them is aimed at? Because I'm reading the legislation, and in places it's a bit vague, and I don't see anything that would give powers to certain people beyond police and inspectors. Could you maybe clarify that?
Yeah, without having a copy of the bill in front of me, I'll just say generally, Jeff, the purpose of these is to make uniform and effective our ability to offer deterrence, whether through fines or more serious penalties if need be, to those who are disrespecting the health and well-being of their fellow citizens. And by empowering our rural municipalities to do this in a more structured way, we can have more consistency throughout the province in the way we go about doing this, better cooperation, better strategic approaches.
Okay, and my follow-up is, of the $400 million that you'll need for COVID-related costs, you mentioned some of them, and you said there'll be more programs coming. Could you give us an idea of what types of programs you're looking at specifically?
Yeah, I'm going to give you more of an idea as we unroll these programs. Now that we have the greater clarity, though it's never perfect from the federal government, we have greater clarity on what their programs are designed to do and how they'll be structured. We're meeting tomorrow with various business and trade organizations to get their input on where we need to fill in gaps. And then, as a consequence of that, I believe early next week, we will be able to outline how we'll underwrite any additional supports here in Manitoba necessary to complement what the federal government is doing rather than to overlap with what they're doing and duplicate it, which will simply create unnecessary confusion for Manitobans, whether it's small business people or others. So that's the game plan. There are other things too that are in development that are nearing readiness, I think, that will assist Manitobans in other categories, if you will, Jeff. But I would say on the small business side, we've been making really good progress, and I would again say thank you to Manitobans and their business organizations that have been very key players in assisting and advising us, so that we've taken the course of action, I think, that will help Manitobans in a more cooperative and better organized manner.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, just looking through the Emergency Measures Amendment Act with my layman, non-lawyer understanding, it seems to me that the powers being granted to Cabinet are pretty broad and perhaps vaguely worded. They can issue an emergency order to prevent or mitigate serious harm on a range of things, including fiscal or economic disruption. What would you say to people who might say that's a broad term? Are we granting Cabinet too many powers to make these decisions behind closed doors?
Well, I would say if you tie my hands, I'm not able to help the way I'd like to, I guess. Steve, in the final analysis, we've got an unprecedented situation that requires us to take actions that, as much as we hope will help and are well thought out, are different from past practices. We don't have the ability to spend months at a time, for example, to develop protective approaches for small businesses that are established in legislation unless we get unanimous agreement from every party every single time. So the fact of the matter is, what we're doing is we're asking for the responsibilities that we were elected to fulfill in an unprecedented time, to take the actions necessary to protect the well-being of Manitobans, both socially and economically. And that is without precedent, but I won't make excuses for it. The fact of the matter is, we have the responsibility to do what's right for Manitobans and for Manitoba as a province.
And my follow-up is a follow-up to Jeff's question. When you talk about additional new measures and you talk about complementing federal moves, are you talking about, for the first time, direct financial assistance to individuals or businesses?
Well, if I told you that today, then I wouldn't be able to tell it to you next week when the details are ironed out, and so I'd prefer to tell it to you next week when the details are ironed out instead.
From City News, Stephanie.
Mr. Premier, Stephanie with you with City News. Also a follow-up to Jeff's question. You mentioned other categories that you'll help Manitobans, and I just wondered if you could specify what some of those might be even broadly.
Yeah, well, I alluded earlier to the working groups we've established in a variety of our industry groups. That's one aspect of the consultative work and the preparatory work that we're doing right now. That's going to lead us, I think, to better recovery. That would be one example. In terms of some of the additional supports, the meetings that we're having in the next couple, 3 days are going to assist us to understand more fully where people may be sliding through the cracks of other programs. For example, the federal government has a CERC program, the $2,000 a month one, I'll just describe it that way. But there are some people who may not be eligible for that program as well. The federal small business loan program has certain qualifications within it. They've changed those several times, so it's a bit of a moving target. But we're hoping for additional clarity there and finalization on that plan so that we can see where we might be able to complement the federal program, not duplicate it. Same thing on the issue of the wage supplement program. It's been brought to our attention. There are a number of Manitoba small businesses that may, for one reason or another, not qualify for some of those programs that the federal government's offering. It's not to criticize their programs. They have to have parameters, and we understand that. But until we understand what their parameters are, we can't effectively complement and work with them in the way we design our programs. So what we're trying to do is make sure we have those questions answered as best as possible so that we can then fill in the gaps that are needed and help, for example, those groups I just mentioned.
What's the plan for the House to sit after today?
Well, I guess I can't tell you that until after today and until I know more about where we're going with this pandemic. To be frank, and I'm not making excuses here, we have, as much as we've needed the legislature to sit today and as much as we've needed agreement from the opposition parties, we have actually got some very, very important work to do on a number of files, and we're doing it. So right now, given not only the urgency of other challenges we have to face, but also, quite frankly, the health interests of MLAs and staff here in the building, it is not imperative that we sit again for some foreseeable future. And we'll tell you more as things unfold, as all of us know more about our progress on flattening the curve of COVID, as we know more about the needs we have to address going forward. We'll know more about when we need to sit again. And I guess that's a muddy way of saying, give me time while we're working on the top priorities of protecting Manitobans and their economy. Just want to say thanks to everybody again. As you know, we're continuing to sit through the afternoon, I expect into the evening. There'll be, I hope, more progress, and I'll be available to take your questions tomorrow and to give you a bit of an update on some of the response to some of our other programming that we've undertaken over the last few days. So we'll talk to you tomorrow. Thanks again to all Manitobans. Stay safe. We'll beat this thing.